Hey friends, in this video I'm going to show you the 3 best exercises and stretches for neck pain that's coming from cervical spondylosis. My name is Dr. David Midoff and I'm a specialist physical therapist at El Paso Manual Physical Therapy, and this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please consider subscribing so that you don't miss out on any of the helpful videos that we post every single week. Now, all of these exercises are going to be done lying down on your back, so find a comfortable place that you can lie down. It could be your bed, maybe the floor on a mat, or if you have a couch or an ottoman or some space that's comfortable to lie down on, that'll work just fine for you. And if you can't quite see the video from where you're lying down, you might watch this video first just to prepare and then go do it and maybe check back in case you need to make sure you're doing the exercises correctly. You'll need just one thing for these exercises: a pillowcase. I've got one right here. You could use a towel or anything that you're willing to tug on, and it's going to go around your head and neck area. So get your pillowcase ready or your towel, and what I like to do is just fold it in half the long way. It doesn't have to be perfect, and then I twist it, or I might fold it again. I'll just fold it again and then twist it from there just to get it into a loose twist like that. I'll hold the ends and I'm going to put that behind my neck and slide it up to the base of the skull, kind of right between where the neck and the skull attach. That's where it's going to rest. Then what you're going to be doing is decompressing your neck bones, because in cervical spondylosis you get a lot of compression through those bones and discs and all the joints in there, and so we're trying to take some pressure off to prepare the movements you're going to go through so that you maximize the benefit of the exercises we're going to do next. So when you pull with the pillowcase, you're going to be pulling and upward towards the ceiling and upward like towards your head, in between the two, so at a 45-degree angle from the surface you're lying down on. So it's going to look like this. I'm going to pull right over here. I'm just going to get this around my ears so it's comfortable and it's not going to fold my ears, and pull, I got my ear a little bit, upward like this. So that's about a 45-degree angle or so. I'm not measuring this, I'm just guessing. But I'm not pulling straight up this way because it'll slide out, and I'm not pulling towards the ceiling because it'll make my head fold up, and that's not the goal here. It's to slightly lift the head, but mainly pull the neck in that direction. And then once you achieve the right position and you get the tension going, then you're gonna bounce slightly, and you can turn your head a little bit and pull in that direction, bend the other way and pull in that direction. You might get joints that pop and click doing this. Sometimes that happens. It might not, and that's okay. You're still getting the force needed through the neck to decompress the spine and get that much needed depressurization, decompression in your neck. I would encourage you to do this for 1 to 2 minutes. After that, people typically get diminishing returns. I mean, it feels good, and it's not gonna hurt you to do more in most cases. So you could do this for as long as you like. You just, we gotta get to the exercises eventually. Don't miss out on those, because there's huge benefit to doing those exercises that we're going to do next. So once you've done this long enough, you can set your pillowcase aside. Next, we're going to do the neck curl exercise for cervical spondylosis. It looks just like this. You're going to first shrug your shoulders up just to take some tension off, then relax the shoulders. Interlock your fingers just like this and put your hands behind your head. Then you're going to lift your head with your hands and do about 60 to 70% of the work with your hands, and subtly help out with your head and neck. So it looks like this. I'm not picking up all the way. I'm going maybe about halfway between lying down and picking up all the way. And then from that position, I'm going to make a double chin. So I'm going to shove my chin into my neck and even my chest a bit. And it's this unflattering position where your extra chin comes out if you've got folds in the area. Everybody's got folds in the area for the most part. And you're going to hold it like this for about 10 seconds. And what I want you to feel is the muscles working behind your throat. Now you might not feel it the first rep or two. It might take you 5 or 6 reps to get it. But as long as you feel these muscles behind the throat, they're called the deep neck flexors. As long as you feel those working, you're on track. What I don't want you to feel are these big muscles on the side, the sternocleidomastoid, and the ones even further out to the sides or on the back of your neck. If you feel all those other muscles working, then 2 things: you're doing this exercise incorrectly. Double check that you're pushing your chin into your neck and chest, or you might just be so overcompensated that you have to use your other muscles to do this motion. If that's the case, then you need to go even more support from your hands and do a very minimal double chin. Play with the edge of the motion just to feel those deep neck flexors working, and only go as hard as you can before the other neck muscles start to fire. So going back to this exercise, I'm gonna lift my head with my hands, then double chin, and I'm gonna hold it there for 10 seconds. And what I like to do is just force my chin into my neck as much as possible. I get a bit of a stretch on the back of my neck, into my upper back even. As long as that stretch goes away right away, it's fine. It shouldn't be a big deal. You're actually doing good stuff for your neck. That's part of what we want. But if you get any lingering symptoms, that's not the best. It's not an emergency or a terribly wrong thing. I wouldn't worry too much, but you don't want to have any lingering symptoms afterwards, like lingering pain, a lingering stretch sensation, or any symptoms that go out anywhere else. That's a sign that you've probably got a nerve problem that you're irritating. Don't proceed if you've got that going on. Lighten this up or stop completely. That'll be rare in most cases. All right, so I'm lifting my head, double chin. I'm feeling those deep neck muscles working behind my throat. Whew, it's pinpointed like right behind my Adam's apple. And we're doing 10 reps, by the way. I might not do them all, I lose count, but count 10 at home. Lifting my head, double chin, forcing my chin into my neck here. I'm shaking even a bit here. And then relax, rest your arms if you need to. My arms are okay, but your arms may get tired. Just go ahead and rest them if you need to. Hold the double chin and then relax. And you should be warming up these muscles right behind your neck. They might even be getting very tired already. You just don't want to get the muscles on the outside, like these big sternocleidomastoid muscles working, or further out. That's not a good thing. I got to repeat it because you're going to make your situation worse if you're strengthening those muscles. It's that important. So once you've done 10 reps of that, now you're ready for a mobility stretch exercise combination. So it's an exercise in that you're going to fire those muscles again, and then you're going to move. It looks just like this. Double chin, and then slide your head over to your ear, and then go to the other side. And do 10 reps like that. 2, rest if you need to, then double chin again when you're ready. 3, double chin and then side bend. Bring your ear to your shoulder. 4, double chin, ear to shoulder, ear to other shoulder. Maintain the double chin. Relax it between reps. Double chin, ear to shoulder, ear to shoulder. And the double chin is really important because you decompress the spine and then make it move uniformly, meaning every vertebrae is forced to move. In cervical spondylosis, some of those joints get stuck, some of those bones don't move very good. But when you fire these deep neck flexors and you decompressed it with the Pillowcase, now you're ready to move better, and you're going to loosen up stiff parts of your neck. So double chin, side bend, and then after you've done the side bending 10 times, you're going to go into rotation. So same thing, double chin, but this time you're going to turn your nose towards your shoulder or towards wherever you're lying down, the floor, the bed, or the couch. So double chin, and then turn, and then come back to the middle. Don't hang out there. Same thing with the side bending. You don't need to hang out there. Double chin, and then turn. Double chin, turn, double chin, turn. You can just keep going if you want. You don't have to stop in the middle if you don't want to. The point is that you keep that, though. I like to build in a break with patients if I see them just turning and then they kind of give up their neck and their head lifts up like that. You got to double check that you're double chinning and then turn. It's a waste of a movement for your neck. You're actually feeding into the problem if you're not double chinning down. You have to keep that double chin whenever you're rotating. So guys, after you do this exercise, go through them again, do the Pillowcase distraction decompression exercise. This should allow you to get up off the floor or the bed, wherever you're lying down, and feel like you warmed up your neck muscles, so you've gotten stability, and then also gain mobility. Your range of motion should improve. Repeat this every day. I'd make this into a routine that you do every morning before you get up. It should help you to feel better in the morning. A lot of people have tons of stiffness in the morning, so you want to do this first thing in the morning. And then if you've been sitting for a while or towards the end of the day, really as needed, go through this routine. And as you get faster at it, you can take as little as 2 minutes to do this whole routine so that you can get mobility fairly quickly. I'll be doing a video real soon that talks about cervical spondylosis in more detail and the differences between cervical spondylosis and arthritis in the neck as well. So watch out for that. Don't forget to subscribe and hit the notification bell so you don't miss out on that video. And please give us a thumbs up on this video so that this video can be seen to other people on YouTube that might be needing help with cervical spondylosis. Thanks so much for watching. See you in the next video. Bye-bye.